Well, good evening, everybody. We're hosting our third virtual Thursday. Tonight, we have a very distinguished speaker as we tackle the topic of managing a pandemic. Joining us tonight is the Honorable Rich Serino, who's a graduate of Catholic Memorial Class of 1971 and a 2011 recipient of the Vince Bona Malum Award. The Vince Bona Malum Award is the highest honor CM bestows on an alumnus who exemplifies distinguished professional achievement and outstanding service to the community. Mr. Serino spent more than 40 years in public service. During that time, he provided extensive leadership on emergency management, emergency medical response, and homeland security at the local, state, federal, and international levels. He is currently a distinguished senior fellow at Harvard University's Chan School of Public Health, its National Preparedness Leadership Institute, and is a senior advisor at MIT's Urban Risk Lab. Mr. Serino was appointed by President Barack Obama and confirmed by the Senate as the Federal Emergency Management Agency's 8th Deputy Administrator in October 2009 and served until 2014. In his role, he also served as the Chief Operating Officer of the agency with more than a $25 billion budget. Prior to his appointment as Deputy Minister, he spent 36 years at Boston EMS, where he rose through the ranks to become the chief. He also served as the Assistant Director of the Boston Public Health Commission. Mr. Serino responded to over 60 national disasters while at FEMA, and during the Superstorm Sandy, he was the lead federal area commander for New York and New Jersey. Mr. Serino has also served on the scene at the Boston Marathon bombings as a Department of Homeland Security senior official. As the agency's COO, Mr. Serino fundamentally changed how FEMA operates. He helped FEMA reorientate its activities and improve its programs to be survivor-centric, ensuring that the agency supports the delivery of services focused on easing the recovery experiences of survivors as individuals, neighborhoods, and communities. He has received more than 35 local, national, international awards for public service and innovation, including Harvard University's National Public Leadership Institute's Leader of the Year. Nationally recognized as an innovator in EMS with the Innovators in EMS Award and Boston's highest public service award, the Henry L. Shattuck Public Service Award. Mr. Serino is also a writer who has published more than 10 articles. He's attended Harvard University's Kennedy School of Government Senior Executives in State and Local Government Program, completed the Harvard School of Public Health National Preparedness Leadership Institute, and graduated from the Executive Leadership Program, Center for Homeland Defense Security at the Naval Postgraduate School. So we have a great speaker with us tonight, and we're really excited to hop in. So Rich, you've had a very distinguished career. Can you share with our alumni, our parents, our faculty, and our students who are all on this call tonight some of what you've been working on over these past few weeks?
Sure, and thank you very much for having me here. I'm thrilled to be back at CM, at least virtually. And you know, CM prepared me for, you know, you listed a bunch of stuff and that was great, but I think probably the base that was given at CM helped the trajectory by far. So I just want to thank you and CM for setting me up for all this. So thank you for that.
Thank you.
And you know, over the last, now about probably almost 3 months, I've been helping out in a various different capacities. The majority of my time is spent initially in New York City, and subsequently from my now home office in the Boston area, helping out New York City as well. Mainly, for a while, it was 16, 18-hour days as to what's going on in New York. Everything from when the initial part started to strike New York City, and then working with the mayor and some of his commissioners and deputy mayors over every part of, the number of patients that increased, and unfortunately, as we see now, the number of deaths that are happening in New York City. In addition to that, doing quite a bit of work with Harvard School of Public Health on this, helping out some corporations and businesses, as well as some folks at MIT, and talking to folks at FEMA pretty much on a regular basis as well.
That's great. That's great. So you've been consulting pretty closely with New York. Can you share some insights into what's really happening on the ground? It's hard to know exactly from the news what what's really happening? What are some of the insights that you've been exposed to from your work?
Well, I think one of the things that is in New York City, which has been the epicenter, that we forget the number of deaths that have happened. Just in New York City alone, they're in the 30,000 to 35,000 range, and probably a bit higher than that. And that's just in New York City. That's 10 times the number of people that lost their lives in 9/11 in New York City. So I think it's just hard it's really hard to wrap your head around just the number of deaths. Early on, some of the problems was in just the pure number of people that came to the hospitals and overwhelmed the ICUs. Thankfully, the number of patients in the ICU has gone down, and that's directly attributed to the social distancing. And I think a lot of people, I was just having this conversation with some folks earlier today, that now that, starting to see in Massachusetts, we're at plateau, starting to come down a little bump up the last couple of days, that as we look at this, the numbers coming down, people say, oh, that's over. Well, no, that has clearly because of the social distancing. And the social distancing does not make the disease go away. With social distancing, and I term flattening the curve, is the whole concept behind that was mainly so the hospitals wouldn't get overwhelmed. That's the main idea of flattening the curve. Nothing else. It was to decrease the number of patients that were coming into a hospital so the hospitals didn't get overwhelmed. New York City, we saw for a few days they did get overwhelmed. We all saw some horrific pictures there. And now, even though the numbers are coming down, so the hospitals can, I wouldn't even say going back to normal, can at least catch their breath from where they were. And, in New York City, there were days that, there were precious few ventilators that were left until more came in. So the tough decisions on who gets a ventilator, who doesn't get a ventilator, didn't have to get made. But those protocols are in place in Massachusetts, was one of the leaders in that. And then in New York City, they didn't get there, and they have enough now. Second surge that's probably going to come either later this summer, depending if people social distance or not, or probably in the fall, remains to be seen. So I think in New York City, they've been very proactive in trying to, and doing things that have never been shut down before, obviously, is all around the country, many places, is they shut down New York City. And essentially, unless you were an essential worker, the streets of New York, as we've seen in the images, are just empty. So I think that they've done a lot of good work. We're learning a lot from New York City, for around the country and around the world, because they've had more cases in New York City than anywhere else in the world. So they've truly been at the epicenter of it. And as we start to go forward, one of the things we are looking at is also the mental health issues that are going to occur, that have been occurring, unfortunately, in EMS personnel as well as hospital personnel, are quite significant. And then once you go past that, just to the general public as well, the mental health issues, I think, are going to be one of the biggest long-term impacts of COVID-19 that we're just starting to address. And of course, unfortunately, the large number of deaths and the large number of people getting ill.
Yeah, I mean, so in your role with EMS, you know firsthand what those responders are going through. And even, I'm sure, the conversations with the officials in New York, that how do you think that our first responders, our healthcare workers, our doctors and nurses, how are they handling some of what they've been through or have seen that's very difficult?
Well, one of the things is actually a great piece on Boston EMS on Boston.com today that I encourage people to take a look at, because it actually talks about some of the challenges that they're facing and how they face them in and day out, how people are, some are staying at hotels, some are staying in Northeastern University dorms, and not seeing their family. So the stress of all they're working at, but then not even be able to go home and be with your family, even adds more stress. So to me, the heroes in this are the EMTs, the paramedics, and the nurses and the doctors, but the nurses of all the work that they've been doing over the past now 3 months has been nothing short of amazing in Boston and New York City and across the country where they've had these cases.
Right, right. So in your field and in Harvard, you've had a chance to work with lots of different leaders in different corporations, to different industries. How would you, I mean, I know you're working with New York, so give a perspective on, as a Bostonian, how would you respond or talk about the leaders that we have here? How are they doing?
Well, I'll admit I'm a little biased.
Sure.
Born and raised and lived in Dorchester. But I think that the Massachusetts and Boston is handling it really well. And literally the folks at the Boston hospitals, some folks at Boston EMS, have literally written the book on disasters, written the book on how to handle the pandemic. So literally 30 years, people have been working on this through the COBTH, the Conference of Boston Teaching Hospitals, probably more than 30 now, that have been working on how all the hospitals will work together in a disaster, never mind, in also a pandemic. And the training that was done, all the different hospitals were trained together and learned the same information. And a lot of them came through the DeValle Institute of Emergency Preparedness at Boston EMS that started after 9/11. But the sharing of equipment, the sharing of ideas, there's monthly meetings that have happened, like I say, for 30 years with the Conference of Boston Teaching Hospitals and the Disaster Subcommittee to address major disasters and incidents such as pandemic. Other hospitals around the country have been looking towards Boston to say, how do we do this? The Mass General has been leading the way with the Harvard School of Public Health for the Department of Health and Human Services under the Assistant Secretary of Preparedness Response, one of 2 places around the country doing a regional catastrophic response for public health incidents. So when I say they literally are the leaders and literally wrote the book, they have been.
Wow.
So I think that they've been able to do that consistently. And you've seen the ripple effects of that both the mayor and the governor have utilized the folks in the city and turned to them for their expertise. And we've seen that constantly, how Boston's been maybe not, ahead of the curve, like San Francisco was the first city, but they were right there in the first bunch as well.
Sure. Yeah, I think that's an important perspective for families to hear, that because Boston has been preparing for these moments. I mean, even in your role, we knew at some point a pandemic was coming. And part of what I've been really impressed by in terms of the mayor and the governor is the humanity in which they've expressed in their press conferences. This is, it's personal for them. And I can feel that. Any insight on conversations maybe in New York or in Boston that you've had, or how do you think the mayor or the governor, how do they manage through this as people?
I think that, I haven't spoken to the mayor or governor here recently, in the past often, but not recently, and speak with the mayor in New York, speaking very frequently, many times a day for a while. And I think that they realize, and they see the numbers, but they also see the people.
Right.
And I think the empathy that they've shown has come through quite a bit. Even I think both the mayor and the governor at some of their press conferences, they know people that have been lost through this, and
Sure.
The empathy has come through. And I think that's important for people to see and people to hear, that every one of the people that unfortunately have died in Massachusetts, and even more importantly, the people who have survived because of the heroic efforts of the nurses and doctors and the pre-hospital care personnel, that all of that has come through, the people that have survived. So this has been tragic, but there's also been the stories that we see of people who, were in comas for 6 weeks and they come out of it and they're doing pretty well. They have a long road to recovery, but they're home, awake, moving around, talking to their family. So I think we have to celebrate those as well.
I agree. So you've been in the Oval Office, you've been in the White House, you've worked at the highest levels. Can you give some perspective on a national level? How do you think this crisis has been managed from start to where we are now?
I think, without getting into the politics, I think it's just been mismanaged from day one. I think that I sit on a couple of National Academy of Sciences and Medicine committees, and I was in Washington in January and literally talked about what was going on in Wuhan from a world renowned epidemiologist who was studying that. And he was sort of showing the path of where it was going in China, where it was going to go around the world. And he didn't say it's a matter of, it's not if, but when.
Right.
He said, the handwriting's on the wall, so take some action. And I remember at that meeting I mentioned about the DPA, or the Defense Production Act, that, you know, a few years or 6 months ago, nobody knew what that was. Unfortunately, I did, because that actually comes under FEMA. And I had to actually testify on its reauthorization. So before that, I honestly didn't know what the Defense Production Act was, but I did a lot of reading and studying in preparation for the hearing. And I mentioned that the DPA is something that could be used in January and should be used now. And essentially people said, no, we don't have to worry about that. And so there was a room full of people much smarter than me, and epidemiologists and many other folks. And they knew this was coming. I mean, we all knew it was coming. And, you know, even Vice President Biden mentioned, he wrote in January saying that, you know, this is coming. And you had a lot of people writing that this is coming. And so the offices that were taken apart over the last few years, the White House offices, people say they didn't exist. No, they did exist. I knew the people that worked at them. As I mentioned, I think to you the other day, that, you know, I used to go out to dinner and have beers with some of those folks at the end of the day. So there was such an office. It did exist. There were very smart people working in it.
Right. So you think about right now, a lot of these states are there's some states are making different decisions. Some are opening, some are closing. You know, we're looking to some regulations or changes starting on the 18th. How do you think that's going to go? What's your initial feedback for the states that have opened up, that have released these stay-at-home orders? You know, what's your perspective on that? And
well, I think
will this stop?
No, I think the states that have opened already, we actually, if you start to look at those states, the numbers are climbing. You know, the incidence of people getting sick are climbing, the deaths are climbing in those states. And we haven't even really seen the peak of those, because once you open it, it's not going to happen like this. It's going to take about a month for people to get in and spread throughout the system, and then you know, into different parts of the community, and then we'll see even a bigger surge. But I think that, you know, we watch this, and it's not like we will, you know, we are seeing it even already, which is earlier than I think a lot of people thought we'd see it.
Yeah, and I think that's the piece that I find very interesting, is we're all hopeful and wanting to get outside and get back to normal. And, you know, I'm looking here to, would be great to have graduation and spring sports, but what if I can reflect back what I'm hearing, you don't see those things as possibilities in the near term?
No, I mean, I don't see anything in the near term. My son is a high school basketball coach. He was the athletic director, and his team was all the way going to the finals. And the day before the finals, is when everything stopped. So I got, and I knew the kids. You know, I went to almost every game, and I got to know the kids really well, and it was devastating to them. But as my son told them, he says, there are things bigger than basketball.
Sure.
There are things bigger than the sports. There's things bigger than a prom, bigger than the graduation. And that's the community that we live in. And we may all have to take a little pause and try and move past where we are. And the kids got it. And it impressed me, you know, as you know, you see the high school kids every day, but the kids impressed me of how they handled it. They were upset, absolutely. And I don't want to say they were devastated. They worked really hard to get to that point, but they got it. They got that, you know, they had to do that. If not for them, for their, you know, for their parents, their grandparents, and for other folks. So I think that, you know, yes, nobody wants to, you know, cancel a basketball game, and nobody wants to cancel a prom or a graduation. Those are things that, we actually all look forward to. The communities look forward to it. But they're the right thing to do. You have to do that. And I wanted to go to a high school. I was at the Garden when they won in the Garden. Now they're going to the state finals, and it's like I was excited. I'm removed from it, and I was like,
Sure.
And I was like, oh man, one more game, let them play. But you have to sort of step back and say, what's better for not just me, what's better for the community? And I think that's where we have to understand the empathy, and people have to not just have empathy, but you have to trust your leaders. And I think that's one thing we've certainly seen in Boston and Massachusetts is, a lot of empathy and a lot of trust.
Yeah, I think you're right. I think I've been struck by from our students. I think they understand that there's an empathy, and there's a moment while they may not see something directly, they recognize what's happening. We've had a number of alumni, one parent that have been hospitalized, and we know a number of our graduates who've passed away from this. And I think that's a very difficult thing for those families that are directly involved. And what do you think that new normal could look like for us?
Well, I think that, there's the new normal, and actually one of my colleagues actually calls it the now normal. And I actually like that term, because the new normal, we're not going to go back to where we were in January of this year. It's not going to exist for probably years, if ever, because I think as we start to look at what the now normal is, what's normal today is not going to be normal in 2 months from now. The middle of July, things will hopefully, opened up a bit. But then as we start to move forward, what it's going to look like in September. I wish I had a crystal ball to tell you what it's going to look like in September. Am I optimistic that students are going to be sitting in classrooms of, I don't remember the class size, mine was pretty big back in the day, of say 25 or 30 in a classroom? I don't think you're going to see that for a while. Whether or not it goes to online or whether it's a mixture, I don't think we're at that decision yet. Some major colleges and universities, largest college system in the country, stated in California that they're going online for the fall semester. So I think as we start to look, the now normal is going to change. We're not going to see people. I'm not going to want to be on a packed red line train, squished like this. People just aren't going to do it. I think we have to look at some of the things they're doing in other parts of the world. In Asia, I have a good friend in Italy that is a similar position that I held at FEMA. And she has been, we've been talking almost daily for a few months now, and things that they're doing is they're starting to open up, and putting squares on a floor in an elevator. You look at 6 people in an elevator. Even now, people are going, I don't even know if I want to get an elevator with 6 people, and I don't want to touch the button. So it's the new normal is going to be the down normal, and I think it's going to evolve and it's going to change. We saw what I thought was a really bad incident on the Cape this past weekend at an ice cream store that people started. Most people probably saw it on the news where,
Sure.
Call in for your ice cream, and I'll admit in a local. The local ice cream store I may have visited once or twice that called ahead for the order. My son actually went down and, just picked it up and brought it home. That's the way we're going to have to adjust for a while. But people who didn't call in demanded to get ice cream, and, calling a 17-year-old girl every name in the book. And then she quit. She stayed the shift, which was amazing. And then she quit, which was like, to me, we have to come out of that, how we're going to deal with the unfortunate way that some people are handling this. And I think we've seen a lot of the best of the come out in people over the last few months. My fear is we're going to see some more of the worst of people coming out.
I think you're right.
We have to be able to, I think the more we can address those issues and other people, it's going to be more peer pressure, I think, that's going to do this than any government official is.
Yeah, I think you're right. Let's stay in the colleges and universities for a moment. So, CSU announced they're going online, but then Arizona State, they've decided that they're going to be open and they're creating their own testing program. right? So two different large regional colleges, they're taking different paths. What's your perspective on those paths, and what advice would you have for the Boston area college presidents?
Well, I think they're not going to listen to me, the college presidents. But anyway, I think you have to look at what your student body is and how the environment that you're looking to for the student have an experience. Is it going to be 100% online? I don't think that's what most college students want. You know, I think they want to have some sort of the experience of being on campus. That's part of what college is. And I think that California's, doing it online is one option. Testing everybody, well, what are the tests? What are you testing for? What are we going to do with the test? And a lot of privacy issues, I think, is going to be the next hurdle to answer with the test. And things they're doing in Asia on testing, that everybody will have their, phone and a QR code to say, oh, you're positive antibodies or whatever on your phone. I don't think you're going to see that in the United States because I think people are going to protect their privacy more. So I think that's going to be an issue. How many people are really going to do it? Unless everybody does it, it's going to lose the effect. So I think the testing at the colleges, you have to have really strict protocols in place of what are you going to do depending on the tests. And does that mean that those students don't attend class, or are they going to be a combination online and the ones in class? So again, it's not going to be the way it was last semester.
Sure.
Even though ASU says they're testing and they're going to see how that goes, I would bet between now and when the fall semester starts, you'll see that changed a bit again, and I think you'll see others change. There's some schools that are talking about a tri-semester. Is if they go in the fall, in the winter, and then in the summer. And if you do all three, either combination of online or you get 3 semesters for the price of 2, then, or you can defer fall and go in the winter, spring, and then in the summer is the second ones, or you could any combination thereof. So I think there's still a lot of colleges and universities are still working through it. And I think still trying to find what the best answer to that question is. I also think you're going to see a number of students look at that if they were either going to school their first year or they've been in school and they're going back to their junior or senior year, to just hit the pause button for a year. And I know I've talked to a lot of parents who are saying, yeah, I want to hit the pause button because I don't want to pay that kind of tuition for not the full experience. And then for those students, I'm actually working on writing some things up, is to do a year of service.
That's great.
Year of service to the country, maybe hopefully locally, to look at FEMA. I started something called FEMA Corps for 18 to 24-year-olds. They do a year of service to the country in disasters. Well, let's take that and expand it. Not just disasters. We're in the biggest disaster the country's ever seen now. And, how do we do that at the same time? Develop a jobs corps for people who are unemployed as well. So I think we have to look at where do we want to go and how we're going to get there. So a long answer to the question, because there is not one answer to any of these.
Sure. No, you talk about the FEMA Corps. I do think that could be one of these silver linings. I was talking to an alum that was teaching in Nashville when that horrific tornado came through, and essentially he hopped into a pickup truck and learned how to use a chainsaw and felt so helpful in working with people to help them clean up their yards and really make a difference. And I think that there's still that genuine spirit of hope that resides within people, that I think in these moments we need to find systematic ways to allow that to flourish. And I think what you're talking about is one of those.
Yeah, I think you have to find a way. And again, it's not that the idea of making money. I think the FEMA Corps, they make about $5,000 for the year, and they get their uniforms and everything taken care of, and they get a little bit of money for food. But the key also is that at the end of their year service, or 10 to 12 months, excuse me, that they then get a stipend for college. I shouldn't say just college, any education, if they want to go to trade school or anything to get a stipend. I think it was about $7,500. And again, that can be adjusted, but you do a year of service to the country, you make a little bit of money, not a lot, but you service, you're actually helping people, and boy, do we need it now. And at the end of it, you get part of your tuition paid, So I think it could be a win-win-win for everybody.
Yeah, to jump back to the testing, that seems to be, for me, one of the areas that I struggle with, because you hear on the news conferences that you can get tested, that there's testing everywhere. I was on the phone on Sunday with a local college president, and he said to me, we would need 16,000 tests to get school opened, and then we would need another 16,000 2 weeks later. We can't get them, so we're now creating our own. What's your take on this myth or this question of, can I be tested?
Right. I think, I think it is a myth that everybody can be tested, first of all, because they can't. And, we probably all know someone that has been sick and they want to get tested. Not just, hey, I want to get tested. People who've been sick and they want to get tested and they haven't been able to get tested. So I think that's the reality. And I know a few people like that they just couldn't get a test and they were sick. And then literally, 3 weeks later, when they're very sick, they finally got tested.
Right.
Just thinking we tested them earlier, but I won't go down that road now. So as we start to look at reopening, testing is going to be the key. And not just testing, I think it's also going to be the contact tracing is, as we start to find out, okay, you're positive now, who are you with, and finding those people and have those people, the initial person quarantine, the others self-isolate. And as they start to do that, then that's when you can start to say, okay, now we know that. But when you do that, you also have to address what are you going to do with those people. And in this case, what are you going to do with the students? If you have students who are, ill and they come to school or class, that's probably the easier group because you're going to send them right to a medical facility. It's the ones that come in and they now say they test positive, but they have no symptoms.
Sure.
So what do you do with them? And are they going to be, they miss 2-3 weeks of class? Are they what are you going to do for them? So there's ripple effects to any decisions that you make. So each one of those have to be thought through as to what are you going to do as an institution if you do have this testing, and then with this testing, what are you going to do? So you have to have it because there's really no way forward. Otherwise, it's haphazard. And checking temperatures is good, but that's almost too late. If you have a temperature, you're pretty sick at that point.
Right.
So there's a lot that you have to start to think about ahead of time when you want to start up. So I think going gradually is key.
Right. So we think about March to now. I think about myself as a leader of a school. We've done I think a tremendous job, faculty, staff, parents, students, in embracing online education. We look to the fall, maybe there's some form of hybrid, right? Maybe there's some in person, maybe there's some virtual. What about the following year, or 18 months from now, or, will we ever return to what was the start of the 2019 school year where, we're having mass in the gym, football practice is going on, kids are hugging in the hallway, everything that defines our community, that esprit de corps, in the camaraderie that exists from our building, do you see that coming back for us in the future?
I think it's going to come back in the future. It's not going to happen this fall. It's not going to happen next spring. And it's going to depend on when there is not just when there's a vaccine. It's going to determine when there's a vaccine and when there's enough vaccine to go around and the majority of the population gets vaccinated. So it's not just getting the vaccine, it's then having enough vaccine to have everybody vaccinated, and then once everybody's vaccinated, to have a significant amount of population vaccinated. Because until you get to that point, I don't think you're going to see. I think the people in general aren't going to go rushing up to hug people now. You're not going to see. You're not going to see football teams playing. I think you may see an increase in some other sports, that as when schools open, because, you know, school it doesn't end at 2 o'clock, or whatever time you get out. Did I just let everybody out early now?
We could do that.
Yeah. But you know, the classrooms is not just school. It's all the other activities that go on in and around the school to make it a community. So I think that, you know, like other sports, tennis, golf, track, you know, on and on and on. When school starts up, I think that having that is going to be important too, as well as the arts and things that people can do without being, you know, literally on top of each other. So I think that it's going to adapt. So I don't think you're going to see things go back to the way they were in, you know, at the beginning of the school year in 2019, until there's a vaccine. And then once a vaccine, the majority of people are vaccinated. I mean, I go back to, you know, I'm going to show my age a bit, when polio was a big deal. I remember lining up, you know, in the basement of St. Gregory School, and, you know, getting a drink of polio, and literally everybody lined up. And then another group of people lined up, I think with smallpox, we just got the shot. Of a certain age has that mark still. But I also remember a large number of students that had polio, and they, you know, had crutches and canes. It was not uncommon when I was in grammar school, in a class of about, you know, 30, to have 5 or 6 kids that had polio and wore crutches and braces. And unfortunately, there's a number of people that didn't make it. And I think I was sort of at the end of that.
Sure.
Because I only remember, because I was in kindergarten or first grade when a lot of that was happening, but all through, you know, the first 8 years at St. Greg's before I went to CM, you know, there were kids in, you know, embraced the crutches. And eventually, as time came on, thankfully, they didn't have to, you know, took years till some in high school that they could get rid of the crutches and braces.
Yeah, I think that's a really important perspective, that, you know, polio was a very serious thing. And, you know, it took FDR and the March of Dimes and those presidential balls that he established to raise the money and awareness for those cures. And it took time. And I think that's the thing that I was so struck by, even in this moment. I remember there was a conversation I had with our assistant head, who's a scientist by training, and saying, like, this is coming fast. And it's a difficult moment to listen to that, because no one wants to believe that that's the reality. And I think even for parents, and every time I talk with you, these are sobering moments, because these pandemics, this possibility has always been real. And it's really how we're going to continue to adapt in those moments, and recognize that in polio, I think beaches were shut down, right? There were kids weren't going to these places, and we've just forgotten that, right? That it's just sort of moved out of our consciousness. And I think we live in a generation, in a time period where everything seems to be solved very quickly for us. And I don't think that, you know, sort of like untying that Gordian knot, there's not one solution for this moment. And I really am still hopeful that there will be some type of a miracle that occurs. But what I'm coming to, unfortunately, embrace is that this is around for a long time. This is not changing quickly.
No, this is going to be here. I mean, in the most optimistic way of looking at, you know, initially it was 12 to 18 months for a vaccine, and people forget that this actually did start in October. In China, a lot of people think it was January. It actually started in October, and then started to spread in November and December. So people were starting to work on this back at the end of last year. So if you go 12 to 18 months at the end of this year, and one thing that's different than 1918 is, you know, the world has changed.
Sure, absolutely.
And the fact that it spread so quickly, because you can be around the world pretty quickly now in a day or less. But on the flip side, as we're having this conversation now, most of us at home, some at work, but, you know, we're talking to each other, similar to the scientists around the world are talking to each other and sharing information that in the past they weren't able to do. So I think that that's important, that, you know, that's going to help. We also have technology that didn't exist back then, and then even now in the last few years, artificial intelligence and machine learning that can help You still have to go through the human trials, and you have to do that, and that takes time. And you have to make sure that it's safe. And the number of vaccines, I think there's 8 that are out there now that could be possible. But they're also, at the same time, most doses, not all, are producing millions of doses now, hoping that it'll work, realizing some will not, but just to try to stay ahead of this. In the past, in 1918, a lot of that didn't happen. So that's a small part that gives me a little bit more hope, but this is not going to change overnight by a long shot. This is going to be, in a year from now, I would love to say, hey, Peter, you got your vaccine today?
Right.
And I think if that's the case, I'll be happy. If it happens before that, even better. But it's certainly not happening by September. Maybe December, and that's really optimistic that anything could happen then. That's just having one that they've proven. So I think we're in for these last 8-12 weeks have been tough. Next 8 to 12 months are going to be tough too.
Sure. So as a parent of some young children, we've all been studying and following this, and so much of this has been geared, at least initially, to the older generation. So parents, grandparents, as of late, we've been seeing these inflammatory illnesses that are now affecting children. And that's been stunning for me watching the news at night. Any thoughts on or insights from your chair or the information networks you live within on that illness?
Yeah, I think it's something that has been, I don't want to say it's new in the last week, but I think it's hit the public a lot in the last week. And it's scary because for the longest time, we thought that kids were okay with this. But now you're starting to hear a lot of stories, and they're documenting these of, even a month, 6 weeks ago, 8 weeks ago, there were not just little kids, but like 12, 13, 14-year-olds with COVID toes. And that was sort of the first people started hearing it. So the numbers you're hearing are high in New York, but I think they're actually, when I say the tip of the iceberg, they're like the pinhead of the iceberg of what's really happening. I think because of the number of people that have had it and didn't go to see a doctor, or the doctor did it on not many people want to go to the doctor, first of all. And the second half of this is, when they do go, it's usually a video telecall at the same time. So I don't think that they're actually, I don't think we're actually seeing the real number.
Yeah, I think that's the piece that I think is alarming for folks, that when you start to think about those healthy 14-year-olds, this is also beginning to put some reality, I think, in for our students, that the youth have that invincibility. And I'll say even someone in their 40s, you feel like you can pretty much do anything. But this virus is attacking people of all ages, and it's mutating as well.
Right. And I think one of the things, everybody thought it was going to, I think in Massachusetts, we've seen, unfortunately, more than 50% of the deaths have been in nursing homes. But outside of that horrific number, if you look at the other numbers, everybody thought it was going to be the 65 to 75s. But when you start looking at the numbers, the 55 to 65 and the 45 to 55 number is just as high as the 65 to 75. I mean, it's fluctuates day. So that's a bit sobering. Doesn't go with what we initially thought. Same with the, kids. We thought kids, and I think that's going to affect how schools are going to open. Because I think that what people were thinking just a month, even 2 weeks ago, what people were thinking about schools, seeing what's happening now with kids is getting people now to start to rethink that. Is how we're able to go. That's
great. I still open it up for folks out there if they want to send in some questions through the chat. Last question for me, and then I'll do sort of some rapid fire if we get some of these questions out there. But can you share a little bit how your faith has helped you in these moments, how your faith has helped you in some of what I'm going to call catastrophic events that you've been witness to or walked through? How has that Catholic education helped you?
Well, I think as I started out, I think not just the Catholic education at CM, but the idea of faith and hope is really what is getting, I think, a lot of us through this. Is that, some of us, as I said, of a certain age got through polio, but then on the flip side, the faith has gotten us through a lot of this, and the hope. People don't underestimate the power of hope. Don't underestimate the power of faith. Each one of us has heard stories and talked to people over when they felt really bad, and their faith is what got them through it. Sure. And talking to people and been literally all over the country, but many parts of the world in disasters, almost every state but one, and as far away as American Samoa, and talking to people, the power of hope is really strong. And I think that's one thing that we all can do, that we can do as a community, that CM can do as a community, is, whether schools open, how they open, what they're going to do. But remember that faith and hope is going to get us through this. The school year of 2020, 2021 is going to be like no other. We have to accept that. Good, bad, and different. It's going to be different, and people are going to do the best they can with the best information they have at the moment. And one of the things that for a long time I've told my students is, tell people what people who are usually higher level, tell people what you know, tell people what you don't know, tell people what you're going to do about it, tell people what they can do about it, and tell them that, by the way, this is, especially in this case, things are going to change. And we have to go back to whatever I told you, some people say a month ago. Now it's almost what I told you a day ago. It's going to change because we're learning more. Like if we say 2 weeks ago, well, kids are fine, so therefore schools are going to be a safe place for kids. Well, guess what? That just got blown out of the water. So things are going to change. And that's where I think the hope and the faith are really going to make a difference.
Yeah, that's incredible. I hear you talk. I read your bio and I know your history. Talk a little bit about that vocation, right? It's clearly there. How did that come about for you? What was that calling like, or how did that career path unfold?
Two things. One was when I was actually 15, I was coming up, I was with my uncle driving up from what I called the Cape, was Pembroke. But at the time it was the Cape on Route 3. And right at Union Street, there was a car accident in front of us. And I remember 3 people got flipped out of their car, thrown out of their car, and pinned under the car. And unfortunately, they passed away, but I felt helpless. And I said, I never want to feel helpless again in any situation. And the second one was when I was at CM, my last semester of my senior year. And I remember that was 1970, early, let's say 71. And, you have to remember the world at that time. I had 2 classes. One was campus unrest, to study what was going on in campuses around the world. The second was an independent study. And you could pick anything you wanted to. And I actually went to work at the Mass General as in what they call transportation, essentially an orderly in the emergency room, move people around. And I had to write a paper on it at the end as my independent study. And that changed my total career path for what I wanted to do. I started after that volunteering at what was then the old Boston Ambulance Squad, volunteer, and then I went to Boston State College, which doesn't exist anymore, is now UMass Boston.
Sure.
Not in the same location. It was on Huntington Ave. And then I started working with the city. So I think that independent study in high school actually triggered me into looking at that. And then as I continued to go, I consider myself, I look at myself, I'm a medic from Dorchester. I born and raised, lived and grew up in Dorchester. And I worked as an EMT and a paramedic, and very fortunate I rose through the ranks. And I still pinch myself that, I was in the White House 2 or 3 times a week for 5 years. I was in the Oval Office, the Situation Room, too many times to count.
Right.
And every time I came out of White House, I literally would pinch myself and say, "What am I doing here?" As I do now, when I have an office in Harvard Square, I'm saying, "What am I doing here?" But I think a lot of it goes back to it was a call. It was a calling, a vocation, and there's nothing else I would have rather been doing at all.
Yeah. It's a beautiful thing. That's a beautiful thing. Any of those sort of God wink moments, I'm sure, in those disaster areas, that the doctors that we had on a week ago, one of them said that, you know, he's seen moments where he thinks there's something else at play.
Oh, I can tell you, you may or may not remember Joplin, tornadoes in Joplin was the worst tornadoes that ever hit this country then and now. It's so the worst. There are total devastation of the city of Joplin. About 3 or 4 weeks before, there was a day that there was 362 tornadoes in the South. You know, went through Tuscaloosa, destroyed Tuscaloosa and Mississippi, part of Alabama, and then Mississippi, and a little bit of one of the other states. And the total devastation then. And then Joplin, literally 3 weeks later, 162 people were killed. 8,000 homes destroyed, 1,000 businesses. And, you know, growing up in Dorchester, tornadoes, we never saw tornadoes. And the first one I saw a few years before that was just, I was like, wow. And it was just total devastation. And I'd seen a lot of devastation, but this one in particular, there were buildings, like 2-story homes, that all that was left was literally dust. They were pulverized. This was such a bad tornado. And just on the outskirts, there was one house that there was literally one wall standing. The rest of the house was gone. This was the early morning. It happened at 6 o'clock, so it was early the next morning, and the sun was coming up. And I remember walking up there, and there was a woman, a grandmother, holding obviously what was her granddaughter and the daughter of the baby there. So 3 generations standing there, and it's vivid in my mind. And there's a American flag that was just, that had been clicked on to the wall that was standing. And then off to the side, I didn't notice it until afterwards, there was what was a mobile home. I wouldn't have known it was a mobile home. And I remember going up talking to these 3, well, 2 women and the baby, and saying, how can we help? It says, we don't need any help. It says, our neighbors have it worse than us. There's nothing left of this home, nothing. And there's one wall up, and the mobile home was the patriarch of the family, the grandfather, and he had died in that, and he wasn't able to get into the house quick enough. And listening to those people and them saying, we don't need any help, go help somebody else. The spirit of people in disasters and how the community comes together. And I saw it in community after community, you know, from Rhode Island to Alaska to Hawaii to American Samoa. And by the way, American Samoa is another 12 hours past Hawaii. I didn't know that until I flew it. So, you know, to seeing it from small communities to large communities to New York City during Sandy, of how people help each other out is what got them through this. And I think that's what's going to get us through this. That's what's going to get us through the COVID-19 response, is us helping each other. And sometimes that may mean, you know, a virtual hug instead of a real hug. That may mean calling up people and checking on them. And that may mean not yelling at a 17-year-old girl trying to get served ice cream. So I think we have to look at how we get through this. We have to look at how we help each other getting through this.
There's a great question that just came in. So taking the politics out of it, if that's possible, how do you think about opening the country versus the long-term economic damage that's taking place currently?
You know, I wish I had a magic answer to that question, but I think, you know, the economic impact to this country, we've all felt it. We've had family members that have feeling it. I think that you also have to look at the lives in the balance. Can I stay in the house another 6 months without going crazy and just in my yard and walking around the neighborhood? No. But I think we have to be safe at how we do it. And I think we have to look and start to see if we see another spike, that we have to realize that, you know, if it's the mayor or the governor that will say we have to go back to shelter in place to save lives and keep businesses going. It's a fine balance, But I think you've seen some unique ways to do it. Even at hospitals initially, when they were taking swabs, they had to get all worn up in all the gear. Now somebody came up with the idea of plexiglass and gloves through it. It's like, okay. So I think you're going to start to see innovations, how we can do things a little better, a little different, social distancing, at the same time of getting people back to work. And that's why I mentioned in the middle of this, just not the service corps, but we have to develop a jobs corps for people at a federal level, and it has to come at a federal level for the funding. The amount of money that has been spent in the past few months has been mind-boggling. Why don't we turn those into real jobs for people and find a way to put people back to work, and at the same time doing it safely and social distancing. And I think if you let people be creative, and this is where I think students can actually play a huge role. I'm a firm believer in that. If you go back and look at the classical, not just classical, most musicians, you go from, the classicals of, Beethoven, Bach, and you go to the Beatles, and you go to, Lizzo. They're all in their teens and early 20s. So, and you look at when people are most creative, not just in music, in architecture, and design, and if you can match their drive, their innovation with some experience, you'll be able to solve a lot of these problems of social distancing. Businesses that never did takeout, they're doing takeout. That's a minor thing, but how can we do it better? Thank God for Instacart and Grubhub. But I think putting more people back to work is going to be the key, but let's do it safely. And if we start to see a surge of cases, maybe we have to, that's why testing is important, the contact tracing is important. So rather than everybody, you have a smaller group of people that you can isolate for a while. So it's not one thing. The testing, if people talk about testing is important. So you don't have to have everybody social distance. So you can do the contact tracing and then say, okay, this group of people, subset of people can go over here. But if you start to see a surge of cases, we don't want to see what happened in New York City in the hospitals and the images of people literally dying in the hallways again. So I think that it's a tough balance, the economy, putting people back to work, but it's not, people say, well, it's elderly. Well, guess what, folks? We're seeing it's not just the elderly. And hopefully out of all this, we're also going to see a change in the way that we care for our elderly. Is that the nursing homes, the number of people who have died in nursing homes is horrific. And I think the people who are working there are people who are trying to do the best they can with probably some of the least amount of training, and also, and I don't mean that certification, I mean, once they're there, they don't train them. So I think that some of the good things we may see out of this is changing not just the culture, but also how we look at how we do things differently. So I'm actually optimistic that we're going to see a lot of positive things in the long run come out of this. And some of the positive things is, I think, how we can be innovative. That is, at the same time, putting people back to work, stimulating the economy, at the same time, keeping people safe. They don't have to be like this. They actually have to be like this, and we have to grow like that too.
Yeah, I think you're right. I think that old adage, the comeback is always bigger than the setback, will be a play. I think creativity is going to be important. How we work the problems, and I think about even schools putting smart people in the room and recognize problems are not going away, so we have to find solutions. And I think that will be key to this. That fourth industrial revolution is really going to be the blending of disciplines, the blending of ideas in companies, in biotech, in tracing. All of that is really that new frontier. And this may push us into that market at a much faster rate than we had ever imagined, out of need and not necessarily out of desire.
Right. And I think you're going to see that. And I think you're also going to see, whatever curriculum you have, I think you'll have the basics. I think you're going to throw that out the window in a year from now, if not sooner. Because what are we teaching, and how do we teach people, and where are we going? I'm not an educational expert, so I'll stop there. But I think how we teach people is going to be different, and what do they absorb, and what do they need to know, and how can we get their ideas out there sooner?
Yeah, and I think now more and more that the problem solving or creating projects and thinking across teams will be important. And I think more and more the value system, the ethics in which we're teaching, that understanding of faith and in that Catholic social teaching is going to be really important as we think about solving these world problems and remembering to take care of those in the margins. That's what I've been so impressed by, Mayor Walsh and our governor. They've really held the voice of the voiceless, and I think that's so important in this moment.
Yeah, more so than ever before. Yeah, I think that I think whenever a tragedy happens, whether it's even snowstorms or flooding or tornadoes, and now pandemic, the people that get hurt the most are usually the most vulnerable.
Right.
And how do we, not saying obviously exclusively by a long shot, but how do we help protect them? And I think that that's one of the things that the basis of the education at CM is going to help with that as well.
Yeah, no, Rich, I want to thank you for this evening. And we talk a lot about with our juniors vocation of pursuing that joy in your life, thinking about what you're good at and what the world needs from you. And you really define that perfect blend of that vocational calling and what we need of you in this world right now. So we're really honored and blessed for your time tonight. And thanks for what you're doing for, the city of New York, what you've done for the city of Boston, what you've done on a national level. You make us proud to be in our ranks as a graduate, and thanks for inspiring our alumni, our parents, our students, and the faculty that are on tonight. We really do sincerely appreciate you giving so much time to us when I know your phone is literally ringing tonight.
Sorry about that.
That's great. No,
I put my cell phone on silent. The house phone, not so much.
No, hey, you're a busy man. So thank you for what you do, and I'll close this as I do with all things, live Jesus in our hearts forever. So thank you so much, Rich.
Okay, thank you. I enjoyed it, and anytime I can ever help the CM community, don't hesitate to ask, and I know you will. And this is great, and thank you. And everybody, just be patient. It's going to be hard, but we can get through this.
Thank you. You give us great hope. Thank you, Rich.
All right, thanks.